I'm here with Dee, and today is going to be your first session with us.
hmm
So I see from your intake you have some general tightness. Um, Tell me more about that and what brings you in and what you're hoping to
Yeah.
accomplish.
Well, I run. So I'm a runner and I do strength training a couple times a week. I'm long distance, so just wear and tear on the body, trying to keep that down. Trying to keep mobility because you only use a certain amount of muscles when you run, and then you have to do the strength training to kind of help with those. But trying to keep injury down and just inflammation down and mobility up and all of that. But after a while, everything starts to ache a little just because you keep using it so much. And I do have tennis elbow because I'm a dog groomer. So
And
repetitive
that's
movement in like the elbow area from brushing and combing and scissoring and all of that stuff. So
and is that showing up just on your right?
yes, just on
Okay.
my right,
And
which is
how,
weird because I'm not right-handed.
oh,
So
okay. How long have you been experiencing the tennis elbow?
probably off and on for a couple of years. This last summer, it's gotten really bad. Um, so
Tell me more about the badness.
the badness. It's just it'll be painful to the touch.
Okay.
If I have an especially grueling day, there'll be sometimes movement can be rough depending. I do wear like compression sleeves when I work out, and sometimes when I groom, just to kind of keep it from going out of whack or being too overextended. Um, and then the other areas I have trouble with sometimes are my knees, just runner's knees, just from they just hurt from sitting in position. Like you sit in a position and you get up. When I run, I feel great, but it's just sometimes afterwards it can be a little
Okay.
tight. I think like the lactic acid builds up, and
Okay.
you can roll it out all you want, but it's not always the same. I don't think.
Gotcha. So tell me, how is your body feeling today?
Pretty good. I mean, I feel pretty good. I don't really have too many aches or pains. It tends to be the worst in the mornings when you first wake up and you've been sitting for long periods. Probably the longest time I ever sit is at night when I go to sleep. So that tends to be the worst. That's really about it. So after I get it moving around a little bit, it starts to loosen up and feel a little bit better. But
And is there certain areas that you notice it
um,
the most when you wake up?
sometimes my lower back, that's
Okay.
being on your feet all day. And then, like I said, my elbows and my knees sometimes. That's usually the worst. My joints just seems like all of my
Okay.
joints. I'm also in my 40s, so I'm getting up there. So, yeah.
Okay. All right. So, like, how much tension or pain would you say you have right now?
Um, I'd say I was like a 5, maybe
Okay.
6,
And where is that showing up in your body?
mainly in my knees and in my elbows.
Okay. All right. And what is the most severe that it's been in the past week?
The last week, it's been maintaining. About 3 weeks ago, I could barely move my arm. So, yeah.
Okay. From a 1 to 10, where would you say the worst one was?
It was like at a 9-10. It was
Nine,
bad.
10. Okay. All right. What have you tried to help with
um,
that?
so my trainer did a lot of like compression and like I don't know, points of pressure where he would release that, so that kind of helped stretch and elongate it. Or the compression sleeve, rest, ice,
Okay.
ibuprofen occasionally. So
Okay.
just yeah,
So, if we can help one thing today, what would that one thing be?
my knees, because whatever, I want to run. I don't.
Okay. I'm surprised.
No.
I would have assumed.
Yeah, I want that to feel better too, but
Okay.
yeah.
And is there a specific knee that you're noticing that's maybe like the loudest today that's like
Today it's
screaming for
this
attention?
one.
Okay, so your right knee.
Mhm.
Okay. And what is that screaming at you today?
Like maybe a 4 or 5.
Okay. And is it more in the front, the
Yeah,
side?
it's like right,
Okay.
like here.
Okay. So the
Maybe.
outer portion of
Yeah.
your knee?
Mhm.
Okay. All right. Do you have any questions for me before we get
I
started?
don't.
All right. So what we're going to do is I'm going to have you take off your shoes.
Sure.
I'm going to have you walk. You walk and take a scroll down and back a few times.
Okay. Good.
Great. All right. And this time I'm going to have you stop right there, face towards me, and keep your sternum forward and just bend your knees and hold. Okay. And push back up. Good. One more time. Great. And back up and go ahead and turn around and bend your knees. Okay. And come back up. And anything noteworthy that calls out to you, Dee, as you bend your knees? Anything that you notice?
No.
Anything that calls out to anyone? Any points of interest that anybody notices that's
right
worth?
leg kind of like bows inwards more.
Okay.
The left one.
Shaking a little from
Get muscles straight.
Oh,
I am kind of double jointed. I'm just so you guys know. But
okay.
I do weird things.
Okay. All right. Last thing, let me have you take your arms up and arms down. Good. Turn around. You're going to do that all over again. Up and down. Good. Okay. All right. Any questions before we get started? Okay. So you're saying it's on the outside. Do you feel more tension on the lower part of your leg or more?
It's going to be more my lower leg.
Okay. So does anybody want to lay on the table and be a second model? I think Candace raised her hand first.
She did?
Yeah. So I see a little bit of rotation, and with just her being a runner, I'm going to assume there's probably some compression up towards the joints. So I want to create some space around her calcaneus just by cupping. And there's a little bit of internal, so I'm going to pull it. Try to get it to the angle where I think would be optimal. Optimal. Light bit of traction. My top hand is going to go right on the top of her foot. I'm going to cup and hold and just pull just a bit. Just thinking about mobilizing around that heel for her. How does that feel, Dee?
Good.
Stay, less, or more?
Stay.
Okay. All right. And since we have so many humans, let's go ahead and get someone else on her left. So cup the bottom, traction. Can you feel that little bit of space that opened up here? Okay. Please do. Yeah, let's get some good traction. So, and if a client did have moist feet from being in shoes all day, or there's an odor that's particularly sensitive to your nose, you can grab a towel, put some alcohol, and wipe down the foot if necessary. Just don't make it weird. We don't need to have a whole conversation with them about it. But it does help to wipe off the oils, especially if they had lotion on their feet, for example. And you can just say that, hey, I'm going to spray a little bit of alcohol so that I can get better traction, because we should have a nice tight grip, traction, pull, especially with someone that's on their feet all day or that's compression. Yes, this is going to help around the joints on the top of her foot, around her heel, and you might feel something drop, but that's not the goal at all. But sometimes we feel a little bit of space open up. Great. And just practice on staying very still. Get your grip and stay. It should feel like you're watching paint dry. But also pay attention to any little subtle shifts that you feel in the client's body. Okay. How does that feel on each side, Dee? Does both sides feel about even in the amount of pressure and the amount of traction that is being given?
They do feel even. This side feels, I can feel it more like behind the I don't know what that is because I don't know my anatomy, but behind like yes, like right where your finger yes,
Yeah.
there. Then on this side, but they both feel good. If that makes any sense. I just feel the pressure different.
All right. So continue there. And let's see. Drop this down and pull. How are you doing? Good. Okay. So we're not going to spend a lot of time on our feet, although I would love to, because a runner probably needs more mobilization. So if we had more time, we could spend a lot of time around the joints to open things up, right? But that's not our goal today. We want to make sure we maximize our time and get into this issue. I'm going to try not to spend too much time, but I could spend an hour just opening this up. I'm going to go for just a few minutes. We're going to spend about 5 minutes opening up around the interosseous membrane, hopefully loosen up around here. And then we're going to start to go more specific around her IT area and around the patella. So we're going to go right where we feel the dip. And we're going to be very specific with our elbow. I like to hold the bottom, have them flex. Good. And let go. And after they start to release the flex, I'm going to try to sink down and go into a more specific Velcro hold. I'm sinking down towards the table, but I'm also Velcroed and up towards the knee. I'm going to make sure to pull my chest up, square off my hips in the direction that I want to end up, which is right about here. All right, let it
And
go.
then go ahead and flex for me, Dee.
How are you doing, Dee? On
Good.
this side, stay less or more.
Maybe a little less.
Okay. Stay less or dash more.
A little less.
Okay.
Better, yeah.
You go ahead
And I
flex
probably
this
waited
ankle
way
one
too
time.
long before I just dug in and assumed, since she wasn't saying
I
anything
can
that
take
it was
it.
good.
That's the best part.
But we want to make sure that it's comfortable and it feels more therapeutic than just digging in.
Right. I appreciate that.
Are we going laterally or superior?
Superior. And maybe have her flex. And yeah, you almost want to find the bone.
Yeah.
And start with broad. And you need to twist her out a little bit here. Yeah. And then you can feel this little dip there. You see that little dip?
Mm-hmm.
That's where we're trying to go into. So it's very, very small. Yeah. And I'm going to start very light. Go ahead and release. After she releases, because when I can really feel the muscles and I can feel the dip. So now that she's released, I kind of ride that dip in. Stay less or more.
Stay's fine.
And we don't want to move once we're here because it is very easy to dip off of here.
Mm-hmm.
Okay. And if you have someone that is very petite, you might be better off using your palm. If you have a child or someone who there's not any surface area there to go into that dip between the bone and the septa, then you can use your palm, press down, and carry those tissues in the direction that you want to go. For her, I want to go up. Could we go laterally? Absolutely. If we feel that things need to be pulled out more, absolutely. It's kind of like riding a wave. You just have to kind of find your sweet spot and stay. but until you do, you're going to kind of pop off, and it's going to feel like you're going to dig into their bone. Just move really, really slow. Think about, I like to align my bone gently resting on top of their bone. Once I feel their bone, I'm going to move right off of it, just a millimeter lateral to where the edge of the bone is. And you can sink down. And here we can stay just with the blade, or we can start to come up and be more specific. Stay less or more.
Stays fine.
On this side too.
Stays fine.
And James, let me go ahead and have you start to take over this side. And her body, especially on this side, feels pretty receptive. She definitely has some nice strong legs, but it's receptive to our touch. So try to get into this area here.
In my lower back and in my shoulder, right? And then if I try to drop down like this, it's putting more pain in my shoulder.
Okay.
Yes, that's fine.
And then if I kick this leg forward, putting more pain in the lower back.
Maybe a chair. Maybe go grab a chair.
Chair.
Yeah. Yeah, so in that case, Elliot, you may want to be here. And so let's move this out of the way. All right, let's start to go up higher, because if we only have a few minutes, we want to make sure that we get closest to the joint. So it's going to be right about this area here, which is usually the hardest part to hook into, right into the middle, and then right up here towards the top. So let's start to go ahead, go into the meat of the low leg, hook in, start broad, sink down, Velcro, and up. And then you can even go slightly laterally too. Stay less or more, Candace, on this side.
What sides?
Stay less or more on the other side. And I can already feel the tissue kind of talking to me and softening in. If we were doing a full focus on knees down, we could ride that wave and maybe see if we can sink in a few more layers. For time restrictions, I feel like it said hello. It's welcomed us. We're ready. And as we go higher up, we're not going to go into the sensitive area. So I'm going to start to go more laterally here. So where I was aligning my bone with her bones, I'm going to start to align my forearm more laterally. So up towards the side, start to sink in. And again, Velcro and out. Your second hand can hold or brace. Stay less or more. More. So I'm going to go a little bit further over. Stay less, more. Stay. So Lucas, try to bring your chest up. Try to come out a little bit. And I'm curious about your right foot.
So it's just kind of chilling back there.
Okay. How would it feel if you had both feet on the ground?
Like I was spreading way too far in order to get this low.
Okay. Yep. Sit on the client. Put a cover over it. Grab the back. Right around where the popliteal area is, and you'll feel the strings. You'll feel the string, and I'm reaching up here. So I'm almost imagining there's the IT. I'm saying hello to it by pushing my finger up, But then, plot twist, I'm going to rotate my fingers towards me. I could go and dedicate some time here, but again, I'm focused on the tib fib and creating more space. So my fingers are pointed towards me, right below the little stringiness. Take a deep breath in and exhale. I'm making sure that I brace myself because this table will tip otherwise. And then I'm pulling. So all of my weight is going into the foot that's on the ground and my thigh, because if I let go, it will start to flip. If I was a bit heavier and she was a bit lighter, it would be a cartoon scene. So lots of adductor work, lots of grounding through your foot to do this, especially with weight variances. And this is a quick and easy way to get some attention if we're thinking about the calves as well. And now I was very pointed to get in close to the top area. I'm not going to be pointed as I go through her calves. She would probably not like us very much if we did that. So once I went down an inch, now I'm thinking about using my entire palm and pulling. I'm not digging in. Stay less or more.
More.
Stay less or more.
Stay.
Okay. So lots of grippy strength work here helps. Elbows in, chest up. Good. And you can also use your forearms if the client needs more. You go in, you can see most of the tissue is now rotating towards the interior part of her leg. Good. Hold, take a deep breath in and out, and rotate the other way. How is that feeling? Stay
Good.
less or more.
More is fine.
Stay less or more.
More.
Stay less more.
Stay.
Good. And we could also do that all the way down. I'll say just a quick hello for good measure. Good.
Feels like it releases back here too when you do that.
Yeah, that's a really good point. So that's helping the traction all the way up into the hip, give some space around the femur, the acetabulum up here, so that all of that compression that's being done on a day-to-day basis has a little bit of opposite force to it. All right, so face towards me. One quick knee bend. Good. How is that feeling? Anything noteworthy as you bend your knees or as you walk?
No, it feels looser.
Okay. Before we start to go higher up, is there anywhere that you're noticing we need to prioritize more time to? I think we have about 20 minutes left.
No.
Okay. Okay. So you were saying you feel most of that pull in and around this area, yeah?
Yeah, there and like in here. Actually, it's equal on both sides. Just this one isn't flared up at the moment.
Okay. All right. So let's do this. Let's have you go back onto the table face up. Focus is going to be, because trust me, I keep gravitating to your IT band and I so badly want to just kind of like dig into the quads, separate posterior, anterior. But I want to get around the joint itself first. And there looks like there's a little bit of stagnation here, maybe a tiny bit of inflammation around her knee. So I'm going to focus around her patella.
Almost like fluid.
Yeah. So I'm going to try to give her region around her patella a bit of a hug. But I also want to say hello here to that IT band. One, so that the client gets some direct contact on that area. And two, so I can start working on this area while I'm doing that. So I'm going to grip the lateral portion of her leg and the inner portion. I'm creating kind of a V, mitten hands. I'm hugging, and then I'm pulling out, and you guessed it, up. So this isn't a super heavy touch or a light touch. It's like just nicely snuggled into the crevice of the patella. Stay less or a little more.
More.
Stay less or more.
More.
I think that's about as far as we're going to go right there for right now. Does this feel more useful or more?
Yes, useful.
Okay. All right, go ahead and give that a try. And the reason I can't really go any further is I'm squeezing as much as I can and I'm pulling out as much as I can without being excessive. But we want to stay nice and still, and I can move my hands a little bit. Does it feel better there or before?
I like that, yeah.
Okay. So what I changed is I'm a little bit more on the blade of my pointer finger, and I'm squeezing a little bit more in as I pull up. Shoulders are back, chest is forward. And I'm going to pull my elbow slightly out and then angle my weight down. Almost like a chest press movement. You should feel your pectoral muscles, your arm muscles activated and working. So if the client was more sensitive, we can just hold, and then we would just want to be bone stacked and up. We've gone over this a few times. Bear claws, grip down, hold.
Oh, wow.
Then I'm just digging straight down and almost like a old school rotary phone, turning it in one direction or the other. How does that feel? Are you feeling any nails or any discomfort with this?
No, I'm fine.
Okay. All right. So here we have two choices now that we're getting further up. I'm going to say hello to the top of the, around the patella, grip, pull out. But now I need to decide, and I'm going to do so with D, is would it be more beneficial for us to create more space, the top of the thigh, or is there more tension front and back? Because it'll determine what position we put her in and where we go with the rest of the time we have. So how are you feeling right now? What are you noticing in your body?
It feels looser, feels airier, but like, yeah, there's more space. Longer, I guess, is a good one. The knees felt like they were moving, like they weren't so stiff. Okay. So that feels good.
When you were just walking.
No, when you guys were doing the bear claw.
So does it feel
and
like...
a great donut. It does. It felt better. Yeah, it does. It feels like it takes off some of that pressure.
Good. Now, do you feel like we need to spend more time today in here, or do we need to travel up further into the thigh and say hello, maybe to some of these restrictions?
I say go for the thigh.
Okay. So here we can use our palm. And since she's saying more of the thigh than the outer portion, I can still kind of work just a little further up than we were, right above the knee. I'm going to find that little dip. I'm not going to go for a specific muscle so much as finding the dip, and hers is really easy to find.
Yeah,
it's like hello. So come feel this dip, because this is a great example of like that dip, that septa, where we can get next to the muscle, not on the muscle. And then we can encourage the muscle. So right where my hand is, go right here. All right. Try right hand over here on her thigh here. The same place I was. Or you could. Stay less or more?
Less.
Stay less or more?
Stay.
Okay. And then rest your hand. You can use your fingers also to slightly pull out or up. Stay less or more?
Stay. It's fine.
Okay. And try a wider stance. So your left leg, see how it feels to, yeah. And try bringing your elbow maybe in. How does it feel to go into a deeper stance here?
Fine.
Stay less or more, Elliot?
Yeah.
We'll get more grippies. I can hear that needs some grip underneath.
Yeah. Stool.
Yeah, just be careful. How are you doing, Deed?
Good.
Any modifications left or right?
Mm-mm.
Okay. Cool. I'm going to push the tissues up. And I can take my other hand, place it right above her knee, and rotate her thigh towards me as I'm adding pressure to stay less or more.
Stay.
Okay. Other side, stay less or more.
Stay.
Okay. I'm just going to hold and wait again. Try that rotation. Try really firmly gripping the inner thigh. And then use that hand to rotate it. There we go.
Hmm.
How are you feeling?
Okay.
I'm going to start to make my way up towards the pelvis. We got around the knee. I'm going to go to the next joint. So I'm going to grip, Velcro, and go up. Stay less or more.
Stay. It's fine.
Okay. Outer hand slightly rotating down and back. Upper hand slightly rotating in and up. I always feel like I don't have the right grip once I get into the dip of the pelvis. So I like to think of where that connective point is and where I feel kind of the strands of the tissues. And I want to be careful because I don't want to go right over the artery or anything. But I'm going to align right around where I think her pelvis is. And you can have her go ahead and bend your knee just a little bit. Bend. I can feel those muscles pop up, and I'm going next to them, thinking to dip down into the septa. Go ahead and release. Good. And I'm at an angle here to match where that dip is and where I want to go, right? Because if she has a little bit of that collapse and internal rotation, I want to give her more width and space. So I'm always just angling my grip and direction where I think they could use more space. So if they're internally rotated, I'm thinking about going out or vice versa. Stay less or more.
More.
I'm going to go over her so I can dip my weight more. Stay less or more.
More.
Okay. And I just felt the pulse a moment ago. So all I need to do is I can stay in the area, is just shift off of it. Are we still good here or do we
Yep,
need to
you're fine.
modify?
Is that the femoral artery?
Yeah.
Before we start to move on, is there any specific spot or anything else that you're feeling that we need to address?
I feel like my back is tense now because my legs are.
Okay.
Make any sense?
Yeah, that
Yeah,
does.
that does. So, I think with that feedback, it's a great place to have you stand and walk, and then we'll do some seated work so that we can open up your back a bit. Great. Okay. Perfect. And go ahead and take a quick knee bend. All right. Good. One more time. Come here.
Yep.
Perfect. Good right there. All right. Go ahead and bend.
Mm-hmm.
And as you bend,
Mm-hmm.
press into my hands just slightly. Good. Perfect. Keep that engagement and that level of effort and come up. Good. Keep a little bit more on this side. Good. Press into this side a little bit. Good. Come down just a centimeter. Keep pressing a little bit more on this side. Good. Keep the engagement with my hands. Good. Come down and keep the engagement. Move really slow. Think about pouring the weight down through your toes, through your feet, all four corners, as they say. And get a little bit more engagement on this right side. Excellent. A little bit more on this left. Okay. Keep that up and start to come up nice and slow. Slow. Okay. How did that feel?
Good.
Good. Okay. Arms by your side. And we're going to get to her back, but I'm going to make sure how much space she has to roll forward. So think about head down and then begin to just let your spine round all the way down. Maybe your chest and your thighs meet, maybe they don't. How does that feel? Are you semi-comfortable in this position?
Mm-hmm.
Great, come on up. Good. Now, if she was only able to get halfway or something, I might want to make sure I grab the bench and have her have some support on the table or grab the pillow so that she's just not very stiff and hanging, but she has the mobility to rest her upper body on her thighs. So we're going to keep her just the way she is. And if I'm putting them back on the table, especially, I don't want to step where the client is laying. It's gross, her feet. So I'm going to move so that my feet are on the table. I can cover this, and after the client leaves, I can properly sanitize table. So for us vertically challenged people, we'll stand on the table so that we get the right height. Now this might feel a little skin pulley as I start to wake my way down, make my way down. But if it feels really annoying or pulley for any reason, let me know. I can usually change up my hands to make it feel less aggressive. And are you comfortable with me bringing up your shirt just so I can access here? Great. Perfect. All right. So I always like to start at the top. I can see here, this is another project for another day, right? And we picked our goal for today. So I'm not going to spend a lot of time here, but I at least want to say hello into this area, especially with the tennis elbow thing. But we're going to make our way down into her back is the goal. But we start here. And there's lots of positioning that we can do with our hands here depending on what the goal is, right? And I could hold here for 20 minutes, but we're not going to for time. Dee, I'm going to have you look up towards the sky.
Mm-hmm.
Good. All right, bring it down, head to chin, and slowly start to roll down. Good. Let your head be heavy, let everything go. And I'm gripped, and I'm pulling and tractioning her down, and I'm just kind of following. Some people, she's got great skin, so I have a bit of a glide. You could use a tiny, 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 tiny bit of lubrication. But sometimes you just need to move, lift your hands up, and move, even if it's over clothing. And we could stay in one spot for a long time. As I go down towards her low back, I might change from fist to the palm of my hand, especially as I get more into that low back. As I get into her low back, I'm not going to need as much height because we're not pushing as much. And I'm taking my fingers out so that I'm not going too close to her midline. And I'm just tractioning. I'm trying to make her wider, especially this band here around the low back. It's really, really tight. And I'm also thinking of where we started or where we last ended, which was around the hip. So I'm thinking of kind of working my way back there to make a whole loop, if you will. Dee, are you okay if I bring your shorts down a little bit?
Yeah, you're fine.
So I'm going to make my way all the way down, and my hands are just going out. And they're thinking about hugging the front of the pelvis, the ASIS area. And this is you can cross here. Left hand is pulling out towards the pelvis. Right hand is thinking about rotating out to the right and superiorly and laterally. Same thing on the other side. And I'm using my weight here. You see I'm kind of moving my hips, shifting to one side and the other. That's going to change the level of sensation and where she's feeling it. Okay. All right. So, Dee, I want you to come up super slow and let your core be what brings you up. Think about pressing your feet into the ground, activating your core. Good. All right. Take a deep breath in. Good, and out. And we can see her work in her shoulders. So I want to touch into here for just a few moments, just because we want to make sure we honor what the client needs. But also, if we see something and there's the opportunity to give it a quick hello, we can. And we might make whatever recommendations that we observed after the session. All right. Especially if a client's leaning on me, I'm not going to move abruptly. I want to move painstakingly slow. And Dee, when you're ready, go ahead and stand up. Give me a quick knee bend. Good. Arms up. Arms down. Good. Go ahead and have a seat. How are you feeling? How is your body feeling?
A lot looser, a little more relaxed. That's good.
How is that area around the knees?
They feel good. They do feel good. I don't feel so tender to the touch. If that makes sense.
Yeah.
So it feels like if they're a little less tender and they're a little bit more, they're not as stiff. So that's good.
It feels like it's still there. It's just a bit
I don't
quieter.
really feel anything right now. So that's good. So.
Okay. Great. Do you have any questions about anything that we did today?
No.
Okay. I definitely would love to spend a bit more time kind of separating around the hips a bit.
Okay.
I know something that caught my attention is the arms.
Oh yeah,
definitely have an opportunity. Would you be able to come back for a few sessions so we could explore a plan?
Sure.
I'm thinking about 5 sessions,
Okay.
especially focused from the knees, spending some time creating separation, front and back of the thighs.
Okay.
Also starting to get into your shoulder girdle and working into the specifics.
Horrible name for that. I mean, it is what it is, but it's horrible.
I never thought about that, but yeah, a girdle for your shoulders, yeah. So I would say come back in a week.
Okay.
We'll see how your body feels and come up with a more concrete plan.
Okay.
In the meantime, just take a note. I'm going to give you a little notebook.
Okay.
If you're willing to do some homework to just kind of log your activities and how you feel. The most important thing to note is if you felt better today,
Mm-hmm.
how long does that better last?
Okay.
Does it last an hour? Does it last a day, a week, etc.? And also, are you sore after you leave? Like similar to a new workout or a really strenuous workout. If it's a little bit of soreness where you're like, huh, I feel like I moved or exercised in a new way,
Mm-hmm.
that's perfectly fine. But if you
Okay.
feel an excessive amount of soreness,
Right.
that's really an indication that your body might need to be toned down a bit. So
Okay.
the level of intensity that we apply, we might need to
Okay.
bring that down.
Bring it down. Okay.
Yeah. Oh,
Very good. Well, thank you.
thank you very much.